My name is Whitney Brown, and I am the Civic Engagement Coordinator at Children First Action Fund. We're hosting this candidate conversation in Allegheny County, where we invited both the incumbents and the challengers in key legislative districts to talk with parents, providers, and community members about early education. Candidates will be asked a series of questions and given roughly 2 minutes to respond, and I will help by keeping time. For the audience, please add your questions in the chat, and we will try to address them at the end of the program if time permits. And so usually at this time, we like to invite a local moderator to step in and discuss the impact of the childcare crisis in the community, but our moderator couldn't make it, so now you're all stuck with me. But I do think that I have a unique perspective to share here. So this is actually our last candidate conversation of the electoral cycle, and I have been driving around the state in the childcare voter van, which if you're on our Facebook group, you've seen many pictures of. And I've been helping to host candidate conversations just like this one in Chester County, Northampton County, Erie, Bucks, and now Allegheny. So yes, believe me when I say all over the state. And I learned so much along the way, visiting childcare centers and libraries, public parks and community centers where parents might not be affiliated with a childcare center, and local small town coffee shops like this one place called Classic Elements that I visited when I was in Johnstown in Cambria County. And I talked to so many locals who are passionate about, of course, their children, but the community as well. And I actually even met some of you a couple of weeks ago when I was in Pittsburgh for a few days. But there are some things that I heard again and again, no matter where I was. So for starters, kids, when they're in quality early care and education, they're building the skills that matter the most. So, and this is not just based off of this one book that I'm reading right now called Nurture Revolution, but from the stories that I've heard from parents and from teachers, early childhood brain development, it demands stimulation, enrichment, and interaction with caring adults. The neural connections that are built in these like really formative early years support the mental and social and emotional functions for their entire life, essentially. And I heard again and again that investments in high quality childcare, pre-K, and evidence-based home visiting, it pays off when children enter school ready to succeed, because they're more likely to stay on track academically. They're more likely to graduate from high school, to pursue higher education and career training, and then just generally become better workers and contributors to our future economy. I also heard that working families not only struggle to find quality care close to home, but they also struggle to afford it. And with the cost of infant and toddler care rising to the level of college tuition, conversations around helping families afford care are extremely important. And we've been talking to parents about subsidies, earned income tax credits, even scholarships. And I heard from more than one provider who mentioned having to bend over backwards to accommodate a family who's faced with a temporary hardship. But I'm not talking about that. I'm talking about long-term solutions. And I think I would be remiss if I didn't also acknowledge the fact that the pandemic played a huge role and left lasting consequences for our children and our families. I heard that a lot while on the road, but this is exactly why ensuring that families have access to supports like mental and behavioral health services now is more vital than ever. So we have to keep talking about increasing access to those resources, because families throughout the state have been feeling more isolated and more alone than ever. But I'm actually here to say today that you're not alone, and we all tuned into this conversation today because we have a hope for a better future for our kids. So despite all of the benefits of early education that we've talked about, tell me why in Allegheny County, providers that responded to a Start Strong PA survey said that they're faced with 511 unfilled staff positions and have 103 closed classrooms. The reality is that in Allegheny County, the number is 2,416. 2,416 children could be served if these programs were fully staffed. That's the better future that we hope for. And so that's what we're here today to talk to our candidates about. I would love to thank the candidates for coming tonight and discussing these important issues. And again, I thank you all for being here. Being a part of this conversation at this time is monumental, and I really do appreciate you all being a part of it. As I mentioned earlier, please add your questions to the chat and I'll keep an eye on it and I will try to address them at the end if time permits. But right now, I would like to introduce our candidates. So here with us today, I saw running for candidacy in House District 44, Hadley Haas. I also saw running for, or currently the representative for House District 30, Arvind Venkat, in attendance. We invited candidates running in Senate District 37. We invited candidates running in Senate District 45, as well as candidates running in House District 33 and House District 38. So folks do pop in. I'll be sure to introduce them when they do arrive. But with the folks that did show up today, I would just love to thank you for your time and attention to this really important issue. And I would like to open the floor for members of the community to ask questions of the candidates that are here today. So candidates will be offered 2 minutes to respond. They have been given the questions ahead of time. And I know that the folks in the community are really interested in hearing some of their answers to these questions. So I would love to open the floor to Michelle to first introduce herself and her program, and then ask question number 1. Michelle.
Thank you. Hello, my name is Michelle Charmello, and I am the Executive Director for Maple Unified Student Academy. We are located in Homestead, which is right outside of what I call downtown Pittsburgh. I'm from New Jersey, so I'm sorry if I'm getting the terms incorrect. And we provide both early childhood and school age, after school care and summer camp programs for children and families in Steel Valley School District and the Mon Valley. So early care and education has a wide range of benefits for children, from developmental to social and emotional benefits. Despite these benefits, over thousands of children in Pennsylvania lack access to this once-in-a-lifetime opportunity. Our Commonwealth ranks 14th out of 27 states with similarly sized pre-K programs in terms of per capita spending. What are your views on the benefits or drawbacks of allocating additional state funding for high-quality early education?
And let's start with Representative Venkat. Oh, you're still muted.
So first of all, thank you for having me. For me, I'm a physician by background, and so I tend to look at things in terms of the science and the data. And I think the arguments are very clear that investment in early childhood education has a return on investment that is multifold. I wouldn't want to quote you a number, but I would imagine that it's at least 5 times, and it's probably closer to 10 times what you for every dollar that you spend. I think the challenge we face in Pennsylvania is that uh, budgets are really, documents that tell you what your priorities are. And we have divided government in Pennsylvania. We have a Democratic House with a one-seat majority. We have a Republican Senate and a Democratic governor. And so coming to a consensus on these types of investment really comes down to differing governing philosophies. I don't have any question of the motivations of my colleagues across the aisle, but I think that when we look at budgeting priorities, it's just a fact that the Democrats in the legislature, including myself, have advocated strongly for more funding for early childhood education, childcare workers. We passed a tripling of the childcare tax credit, but we have not been able to make the investments that I believe that we should in early childhood education and in getting more people into the childcare workforce. And that's where, without being overtly political, elections have consequences, and we're very rapidly approaching an election that will determine the direction for our country and for our state.
Thank you. Candidate Haas?
Sure. Thank you very much. Thank you, Whitney, for hosting this event. And thank you for the question, Michelle. I'm really grateful to be a part of this conversation. I come to this with a little bit of a different perspective than Representative Venkat. Really my advocacy that brought me to politics has been shaped by my perspectives as a mom, and my sons were both born deaf. And so I'm acutely aware of the importance of investing in early education, and I had to advocate really strongly for my kids, specifically my younger son. We had to go to mediation and really had to advocate for the services that we felt were beneficial for him. And the argument throughout that advocacy journey was that investing in this kid early would pay dividends later on, that the more we gave him in those first couple of years of his school experience, the less we would have to pay later on in terms of interventions and things to help him catch up later. And so I, ultimately believe absolutely with Representative Venkat that there is no better investment that we can make than putting dollars into our kids in the earliest years of their life. And when I'm in Harrisburg, I will always advocate that that be a budget priority and make sure that we're doing everything we can to fund these programs and give these kids the start that they need. And I see no drawbacks in doing that, except the fact that we have to negotiate potentially across the aisle if we continue to have divided government.
Thank you. Thank you for those answers. For question number 2, I will turn it over to Kristen.
Hello, I'm Kristen, and I work with the Early Head Start program in Allegheny County, and I run the home visiting department. We also operate classrooms and have partnerships with child care centers. And my question for you tonight is, high-quality childcare is not only educationally rich for the children that participate, but childcare is what keeps the economy going. The childcare system was already operating on razor-thin margins and is now facing a labor shortage. According to the IFO, the average childcare teacher in Pennsylvania only earns $15.15 per hour, while the wages for kindergarten teachers with similar credentials are $36.58. What are your ideas about how to adequately compensate and improve the retention of qualified professionals who educate our children?
Thanks, Kristen. And Candidate Haas, we'll start with you.
Thank you so much for the question, Kristen. I think this is a really interesting question. And I don't know what the easy answer is. Obviously, I don't think there is an easy answer, but I think that there are things that we can look at. Things like potentially establishing a wage board that would gather stakeholders to make recommendations to establish like a wage ladder and look at compensation standards relative to experience and the educational qualifications of staff. I think we can look at the state level to bolster scholarship programs to, help potential early education teachers complete 2 or 4 year degrees and help to build up the supply of teachers that way by providing scholarship dollars, especially in underserved populations, to have more diversity in the ranks of early education teachers as well. And I think, we need to look at the state level about looking at benefits for teachers. I know often our early education teachers don't have healthcare benefits or paid time off. And I think that that's really important too. And so I think we need to look at some of those minimum thresholds to help get them closer to their kindergarten counterparts and look at how we can do that in a logical way. But I think there are a lot of things that I would like to look at when I get into office in Harrisburg.
Thank you. And Representative Venkat?
So I agree with Hadley, and there has been a push at the state level for the state to subsidize childcare staffing salaries. It hasn't really gone anywhere. I certainly have supported it. I believe that we need to do it. We tripled the childcare tax credit, but it doesn't do any good if there are not spots for people to be able to actually spend the money that they now may have for childcare. I think on a larger level, when we're talking about these very difficult jobs, and being an early childhood teacher is not an easy job, we need to be exposing kids at an earlier stage in their education to the opportunities in these fields. A.W. Beatty is a career education institution that's in my district. It serves 9 school districts in Allegheny County. They do have an early childhood education program. I think that is something we need to bolster. I think we need to treat this almost like a military recruitment process where we say, we will pay for your education, and then you go where we need you to go for 4 years, 6 years, whatever the case may be, at reasonable salaries. And I think at a national level, when we're talking about all of these jobs, and early childhood education is certainly among them, if we're not having a serious conversation about legal immigration and having more channels of legal immigration related to the workforce needs that we have, especially in Western Pennsylvania, where we have a flat aging population, we are not going to be able to meet our needs, not only in early childhood education, but in healthcare, in agriculture, in policing, in any number of fields that are not easy to recruit people into, because we are having a rhetorical, frankly, counterproductive debate about the nature of what immigration can support and can help in our communities. So I would add that as a piece that isn't necessarily a state legislative piece, but is a policy piece that needs to be advocated for in our community.
Thank you. And so a quick follow-up question. Do you believe that early education teachers with a bachelor's degree should have pay parity with their K-12 counterparts with the same degree? Can be a yes or no question. And candidate Hass, I'll start with you.
Yeah, I think in an ideal world, absolutely, that would make sense. I don't know what all the obstacles are that are keeping us from getting there at this point, but I think it's something we should absolutely work toward.
Great. Representative Venkat?
I would say yes. I answered yes 2 years ago when I was asked this question in the same forum. I think, again, it goes to the return on investment in terms of having highly qualified educators in early childhood classrooms is critically important for childhood development. And so, of course, they should be compensated accordingly. I think it again goes to where are our priorities as state government. We haven't raised the minimum wage in this state in a dozen years. We still have a minimum wage that is lower than every surrounding state. And that is something that, again, without getting overtly political, that is the consequence of the structure of government that we have right now in our state. So when we're talking about wage scales, it goes back to what is the floor? What is state policy? How are we recruiting people into the workforce? And what are we prioritizing?
Yeah, absolutely. Thank you for those answers. I will move on to question number 3. This one's for me. So, given the caps to domestic spending on early learning investments at the federal level, what role do you envision for the state government in providing additional investments to pre-K and quality childcare programs? And Rep. Venkat, we'll start with you.
I think it again goes to what are your priorities? I mean, in our budget from the State House, we put forward a budget that would have bolstered public education and education in general, much more so than what we were able to finally come to an agreement with the state Senate and the governor. And, you know, my colleagues, it's been pointed out over and over again that there's a $14 billion surplus in Pennsylvania. And what my colleagues have across the aisle have proposed to do with that is a broad-based income tax cut, which because we have a flat tax in Pennsylvania that disproportionately benefits those who are the most well-off in Pennsylvania. If we really wanted to help people in Pennsylvania with some type of tax cut, we would increase the personal exemption so that more people who are at the lower end of income scales would keep more of their money. But that was not what was proposed. And this is where we end up with 2 very different philosophies of government. We don't have domestic caps in Pennsylvania per se, but we are constitutionally required to have a balanced budget. And so how we go about prioritizing among the many things that state government is being asked to do. Again, we as House Democrats have prioritized education as a whole as our number 1 priority, and that includes early childhood education. But we need governing partners to go along with that.
Mm-hmm. Absolutely. Thank you. Candidate Haas?
So certainly I support and, echo everything that Representative Venkat has said. I mean, I think specifically Pennsylvania has programs like Child Care Works that is subsidized care program for child care. And I think specifically bolstering and increasing funding for CCW would help address this problem. And that would be a priority for me in any budgeting process. I think it's also worth noting that my opponent did vote no on raising the minimum wage and has said repeatedly that she doesn't think the government has any role in setting wages. So to Arvin's point, there are very different philosophies here, and we believe in funding education and providing people with a livable wage in order for our communities and our economy to thrive.
Absolutely. Thank you for both of those answers. I will give the floor to Beth, who will be asking question number 4. Oh, still muted, Beth.
Can you hear me now?
Yes.
Okay, great. Thank you so much, Representative Venkat and Candidate Haas, for being here. My name is Beth Rupert, and I live in Hampton Township, but I do own schools, one in Wexford and one also in Hampton Township. So I service everybody in your district. And my question is, many parents find themselves on a long wait list to receive high quality childcare close to home. This prevents the children from obtaining educational opportunities available at these high quality programs, but it also prevents a full recovery of the economy due to some families having to stay home rather than work due to the high cost of childcare. What is the role of state government in solving this issue?
And I will let Candidate Haas take this one first. We'll just keep switching.
Thank you, Beth, for the question. I remember, my kids are now 18 and 20, but I remember trying to figure this kind of thing out myself. My kids, like I said, they had hearing loss, so I wasn't comfortable with just putting them in any childcare situation. I wanted to make sure that they had specialized care, and I also was concerned about the commute and how we would manage everything. And so it was tricky. We did a bunch of different Band-Aids. We tried a nanny share, all sorts of things. My sister watched my kids at one point in time. So I know what a challenge this is for families. And I think as legislators, we need to get creative and look at what's successful in other states and maybe look at piloting some things. Think even looking at like family, friend, and neighbor programs and providing technical assistance and startup grants to programs like that to make sure that they're providing high quality services for families could be one option to look at to make sure that there are more localized options for people in childcare deserts and that they have access to high quality care. So I think we should be creative. I think that the state has a responsibility to listen to constituents and see what they're facing and see what ways we can get creative to solve these problems, looking at best practices from other parts of the state and other states within the country.
Thank you.
Thank you.
So Beth, it's good to see you.
Hi, how are you?
Yeah, so Beth is very much embedded in the areas that I represent in the North Hills. So thank you for all you do.
Thank you.
This again goes back to the issue of philosophies of government and philosophies of what we should be prioritizing. My personal view is that this is an economic issue. When we are pulling people, largely women, out of the workforce, when they are desperately needed in an economic situation where we have a growing economy, we have workforce shortages, that is the economic case for why we need to prioritize investment in early childhood care and early childhood education. I have colleagues across the aisle who say, I want largely mothers to be able to stay at home. And if they end up staying at home because the cost of childcare is too high, then that's okay, because this isn't a proper government function. And I think again, this goes to the priorities that we put in state government funding. I have said, and you've heard me say it, that this needs to be a priority, and that we have tried to put our money where our mouth is as House Democrats on this issue. I think it again goes to, as Hadley pointed out, there are best practices out there. There are cities and states that have made early childhood education a priority and have invested accordingly because they've set an objective to say that every child should be able to have access to early childhood education. I agree with that. We're not there yet in Pennsylvania within the structure of our government. So this is going to be, to borrow a football analogy, 3 yards in a cloud of dust about how we incrementally move the ball to make this a priority. So I'd love to give you an answer that says we're going to do A, B, and C, but the way government is structured right now, I don't see that happening unless there's a major call from voters to say this is a priority by electing officials who will make this a priority.
Absolutely. Very much one of the goals of the Child Care Voter campaign as well. Thank you for that. I'll give the floor back to Beth because you're asking question number 5.
Yes, thank you. Providers and parents have discussed a general uptick in the need for children to seek mental health supports. Children have felt the adverse effects on their mental health. According to data from the Children's Hospital Association and Maude Children's Hospital's national report, more than 1 in 4 parents said that their child visited a mental health specialist, with nearly 60% of those reporting a visit within the past year. My question is, which mental health supports are needed most in your district, and how will you work to increase access for families that need these supports for their young children?
Representative, we'll start with you.
So first of all, thank you for the question. As an ER doc, I have seen the crisis in mental health care in our country in a very particular way. Since the 1960s, we have essentially created a system where emergency departments and jails are the source of acute mental health care in our country, and not successfully in either place. When I look at my district, I would say that school-based mental health services is critically important. We are seeing a very significant burden of pediatric mental health care issues that are manifesting in school age, starting at, kindergarten, first grade, all the way through adolescence and into high school. So that's one part of it. The other part is that we need to look at the mental health workforce in general and really look to models that have been successful. Too often in state government, we look for the easy answer to say, oh, if we just give this provider prescribing authority, or we, expanded the scope of practice for that provider, that would solve the issue. When it doesn't really get to the quality of care and the access to care that people need. And so I've been a big supporter of collaborative care models to leverage psychiatrists, psychologists, physician assistants, nurse practitioners, school nurses, so that there is a kind of a spectrum of care that is more seamless, as opposed to saying that there is a silver bullet in this area. So, the two areas that I would want to emphasize are the mental health care workforce and school-based mental health services.
Great, thank you. I like that collaborative care model. And candidate Haas?
Yeah, thank you. I wrote that down too. I think collaborative care model really resonates with me, not just from the clinical perspective, but here I live in the Quaker Valley School District, and we have this group called Youth Connect that is a consortium of local groups and parents and schools who meet regularly to discuss the issues and challenges facing our kids. And I think that that's a model that is really important in our communities, and I would like to see replicated and reinforced, where we have the school counselors and psychologists, we have the resource officers, we have members of the community, we have members of our YMCA, all come together and talk through with parents about the issues and challenges that kids are facing, and then come up with programs that can help address those issues. I know, my kids, like I said, just finished high school. I know I've heard recently of 2 local suicides of young men in the surrounding communities. And I think that we all need to be vigilant and remove any sort of stigma around mental health in schools, and look at investing in programs that ensure that kids feel comfortable seeking services, and that services are readily available in an accessible way. And as Arvin said, I think that starts with making sure that we have enough investment in school-based psychologists and counselors, and then working from there, but making sure that we're including coaches and school nurses and private therapists and the whole team, as well as parents, in the process, to stay vigilant and look at our kids and make sure that nothing's falling through the gaps.
Absolutely. I definitely heard on the road a lot, it takes a whole village, right? So if the whole village is talking, then at least everyone's on the same page. So I appreciate that. Thank you. Back to Kristen for question number 6.
Okay. Well, as many of you know, or as you may know, evidence-based home visiting has a positive lifelong impact for vulnerable families. With home visitation, parents and other primary caregivers receive consistent parenting education and assistance with medical care coordination. Home visitation also builds trusting relationships with families and promotes goal setting that helps increase the number of positive family outcomes, including stable, safe home environments and an understanding of their children's growth and development. Currently, approximately 2% of all children under 6 and only 5% of low-income children under 6 are receiving these critical services. How will you support the expansion of state investment dollars to serve those in your district who can benefit from these types of home visiting?
Thanks, Kristen. I will give it to candidate Haas, please, to start.
Thanks, Kristen. Thanks, Whitney. So again, my kids benefited from early intervention services. So I had all sorts of therapists and care providers in my home, and I can speak to the effectiveness of that. There's just a comfort level when someone comes into your home and they're able to sit with you and show you the best place to sit with your kid to do speech therapy exercises with them, the best toys that you might have around to use, how you can incorporate it into your daily routine. And those therapists who were in my home regularly became a valuable part of my support network during those early difficult days. So I 100% can vouch for the efficacy of these types of services. And I think as a state representative, as Representative Venkat has said over and over, it's about balancing things within the budget. But I think it would be important to start at looking at, who are the kids that we could expand this program to benefit from. What would we be able to do incrementally to expand it? What would that cost and what would the benefit ultimately be? But I absolutely think there is merit in looking at providing that type of home-based services to more children, and looking at ways that we can do that within the budgeting process.
Thank you. Representative Venkat?
In my time in office, in this term of office, there has been a real focus on maternal health and infant health and infant mortality. A lot of it has come because of the really shameful data we have on Black maternal health in Pennsylvania. And it's really my colleagues in the Black Caucus who started the Black Maternal Health Caucus as a specific focus and had a package of bills, the so-called Momnibus, that was meant to address these issues. And certainly parental visitation and parental mentorship is really important in terms of those who may, we're not either planning to become a parent or are not necessarily in the social circumstance that would optimize the outcomes for their children. We have to be careful that we don't want to be the nanny state in terms of government saying what is right and what is wrong in this area. But I think that there are basics that government can make a difference in providing resources to allow home visitation, and it has worked. And so it is something that I would love to see. I think, again, the return on investment is quite high, but it has been a challenge to even get agreement on the simplest things when it comes to this area, such as doula coverage within the Medicaid program, whether it is dealing with postpartum depression and being able to identify the risks for that. These are areas where it should not be a partisan issue, and it has still been very challenging to get them across the finish line. So I'm certainly an ally on this, but there's still a lot of work to do to have a structure of state government that would allow that to take place.
Thank you. Thanks so much. And let's move on to question number 7. Michelle, are you still here? There you are.
I am. I'm not sure what was happening. I got kicked off, so hopefully I won't again. So as of today, there are only 13 states plus the District of Columbia that have passed or implemented paid family and medical leave programs for when a new child arrives or a serious health crisis strikes that of yourself or a close loved one. 4 paid family and medical leave policies. However, in Pennsylvania, 66% of workers, totaling about 3.5 million people, don't have access to paid leave. Parents we've spoken to have said that paid leave would give them the ability to bond with a new child and recover from childbirth without having to sacrifice their family's financial stability. Would you support paid leave legislation in Pennsylvania, and why?
Thanks, Michelle. Representative?
So I'm a co-sponsor of paid family medical leave legislation in the state house. I'm fully supportive of it. I've spoken at press conferences about it. I've recently had a family circumstance where paid family leave was absolutely necessary for family members that I had who were dealing with a medical crisis. And I frankly think it's a moral issue. We should not be a country and should not be a state where when there is a family member who is sick or someone has a new child, that we view it as a burden and not a blessing, and that we don't treat it as the important well-being event that it should be viewed as. And so I'm certainly supportive of that. I'm optimistic there is bipartisan support for paid family leave legislation in the legislature. There is also concern from the business community about how are we going to pay for it? And actually, the legislation that has had bipartisan support would treat this not dissimilar to Social Security, where there would be employee contributions in order to cover the cost for paid family leave. And we need to look that square in the eye and say, if we're going to do this, which I absolutely think we should, everybody's going to have skin in the game on this, not dissimilar to how Social Security is structured. So I think that's the approach that we're going to take. But as a matter of public policy and frankly, morality, I absolutely am a supporter of paid family leave for those reasons.
Thank you. Thanks so much. Candidate Haas?
Yeah, so first I want to thank Representative Benkett for his leadership on this issue. I absolutely agree with his perspective on this. The other way that he's a leader is in knocking doors, and that's something that I've done a lot in this campaign process as well. And it's actually the aspect of the campaign that I find the most beneficial, valuable, and enjoyable. And one of the first doors I knocked was a young couple who had recently moved to the area from New York. And the first thing the new dad said to me when he opened his door was paid family leave, make it happen. Like, we had it in New York. We can't believe that we don't have it in Pennsylvania. My wife just had a baby. It was very disruptive to her family that this wasn't an option for us. So that was something I took one of my first notes on one of my first doors that I knocked. And then more recently, I knocked a door of a mom with an older child who had just had a severe mental health crisis, and she ended up losing her job because she had to take leave to take care of her son. And, I took that note as well. So we all are going to face difficulties and have to care for loved ones. And I think that, as Arvin said, this is a moral issue. And I am encouraged that there's been some bipartisan movement on this. And I look forward to being part of the process to get this over the finish line in Pennsylvania.
Yes, absolutely. Thank you. Thank you both for that. I will read off the last question, question 8, and then I will give the folks in the chat who've been putting a couple of questions an opportunity to ask their questions as well before giving the candidates a moment to give a closing statement and ask for your vote. So question number 8, we want to close out by returning to the workforce and economy issues. We know that many businesses are facing a labor shortage. Childcare access, transportation access, and food and housing security all impact an individual's ability to perform as a reliable employee. They can all contribute to staffing shortages that employers experience both in and outside the early learning sector. So the question, in addition to making childcare more accessible and affordable, what other policies would you champion to help businesses facing a workforce shortage? And Candidate Haas, I'll start with you.
Sure, thank you for the question. So one of the things that they have tried to say against me in my campaign, they've tried to use the fact that for a time I lived out of state. I lived in Chicago for a period of time. And I love living in Pittsburgh. There's very little that I miss. But one of the things is reliable public transportation and how you could be a very productive member of society without a car. I didn't have a car for many years or several years when I lived in Chicago. And I think that, you know, continued investment in reliable public transportation here in this region, understanding that it's more difficult with the hills and tunnels and mountains than it is in the flatter parts of the country, but we need to continue to analyze and improve our public transportation here to make it a more livable place and to make, I mean, honestly, to make it viable for people to come from the city out to my district for jobs, to work in healthcare jobs or education jobs out here without having to pay for a car and insurance and everything that entails. I think affordable housing is something that we know is an issue across the country right now. I think there are things that we can look to do, whether it's subsidizing builders to you know, build more affordable housing versus the higher ticket big McMansions, you know, making sure that there are options for families to enter at a lower price point or individuals. And then, you know, Arvind referenced this earlier, but, you know, I think we need to look at meaningful immigration reform and pathways to citizenship. We know that we have people who would love to fill some of these jobs that we can't find people for locally. And so how can we, you know, work across the aisle, especially at the federal level, but to make sure that there are pathways for people who want to do these jobs in this country that will help our economy thrive. And I think that that would be a meaningful impact for the childcare industry as well.
Great, thank you. Representative?
I agree with everything that Hadley said. I will just highlight that public transportation is about to face a very significant crisis in Pennsylvania because we did not do our job in the legislature to fund what is needed to save and to bolster public transportation across the state. Before I left Harrisburg earlier this week, we again passed a bill that would have made sure that public transportation in the state it wasn't even that it was going to bolster it was just going to sustain the the level of public transportation that we have now, and that was not enacted into law. So it is very likely that both Pittsburgh Regional Transit, Southeast Pennsylvania Transportation Authority, SEPTA in the Philadelphia region, and others across the state are going to have to start raising fares and cutting services, which are already pretty bare bone in order to do this. So I agree with what Hadley said. You know, public transportation is important, affordable housing is important, raising the minimum wage is important, and immigration is important in order to look at how do we sustainably have a workforce for early childhood education and early child care in general. You know, this is a math issue. You don't have to, whether you're on whichever side of the political aisle you're on, there are too few people who are able to afford being an early childhood educator relative to the demand. And so guess what? There's going to be a shortage, and we are seeing that now. So this isn't a red or blue issue. This is a math problem, and we should be able to solve it if we're willing to get out of our political boxes.
Absolutely, absolutely. So that is the end of the prepared questions, but we did have two questions from the audience, one from Lindsay and one from Heather. And so I've invited both of them to read their questions aloud. The candidates have not seen these questions yet, so give you all a second to read them. They are in the chat, but then Lindsay, do you mind unmuting and reading your question for the audience? Thank you.
Absolutely. Hey, everybody. My name is Lindsay Ramsey. I'm the executive director over at Shady Lane School. My question is, nationally and at a state level, the early learning sector has had difficulties determining what the true cost of care is. And that's further continued to strain childcare business models and inadequate investments for the field. What ideas or approaches do you think our state can take to be most effective in revealing data to identify what the true cost of care actually is?
Okay, I will give this one to Representative Venkat, please.
Sure. Thank you, Lindsay. I will answer the question with a question because I don't think state legislators or state government is going to come up with the answer to this. I think the childcare industry is going to have to tell us what they need in order to ascertain the true cost of care, whether that is grant funding to some type of academic institution to be able to do a very deliberate study on this, whether it is going to be the child care organizations identifying what are the data points that are needed. One of the first things I've learned in the legislature is that I'm expected to legislate on everything, but I have no idea about most of the things that are coming before me, and that I rely on expertise, whether it's in childcare or healthcare or whatever the case may be, in order to make, reasonable decisions on these issues. So I'm not trying to punt the question. I'm just telling you very forthrightly that this is going to need to come from the childcare industry much more than it is going to come from state government coming up with an answer for you. We can fund a solution. We can pass legislation that will mandate a particular process, but I don't know what the right process is at this point.
Thank you for that. Thank you for that. Candidate Haas?
Yeah, I mean, I would just say to add on to that, I mean, I think to me, commissioning a study and maybe seeking grant funding to pay for that study would make the most sense. But, as he said, and this is definitely as a candidate, it is hard to be an expert. You can't be an expert in all things. And so what I seek to do is show up and listen as much as possible to the experts and the stakeholders in this. But it certainly seems to me that getting funding to commission a study that establishes a baseline would make sense.
Absolutely. And just working in the advocacy field, we can get those data points. We will get those data points. So thank you so much for that question, Lindsay.
Thank you so much.
I will turn it over to Heather to read the question that you posed in the chat.
Thank you so much, Whitney. And thank you both so much for having us here tonight to speak with you about this industry and the crisis that we're working through. My name's Heather Wells. I'm the owner and director of the Growing Garden Child Care Center. And I am also a Teach Plus policy fellow for this year. And my question for you is something that we were working on last year and is coming around to work again on this year. Last year, we advocated for the $284 million for the workforce development and retention. And this year, we're going to be doing the same again. But what our industry really needs is systemic change to antiquated oversight and budgeting. What systemic changes do you recognize as needing to be implemented in order to properly support the childcare industry in a manner that creates fair access to quality programming and financial stability?
Okay, on the spot, Candidate Haas, do you have an answer?
This is a heavy question for sure. So I don't have a good answer for you right now. This is something that is, all of these issues are absolutely priorities for me, and something that I would seek to sit down and hear from stakeholders and experts in the field and look at. I can't in good faith tell you what exactly the systemic changes that are needed. I think we've talked about some of them, that we need to find ways to pay providers more. We need to find ways to make it more affordable for families in our underserved communities, especially to pay for childcare. But, beyond those basic statements about the improvements that we need to make, I think, looking at the system and the process and the oversight is something that I would have to spend a lot more time on with people who are a lot closer to these issues than I've had the privilege of being at this time. But certainly, I will be a champion for you all and for this issue in Harrisburg, and look forward to seeing you all on those advocacy days when you come to lobby for these things and to learn from you as part of the process. It's something that I find most rewarding is to listening to constituents and hearing and learning about these things. So I look forward to doing that.
Thank you for your answer, Representative Venkat.
Yeah, Heather, I don't have a perfect answer for you by any stretch of the imagination. I do think money is part of it, in terms of recruitment and retention of the childcare workforce, making sure that people are earning a living wage and that we are bringing people into the workforce and incentivizing them to stay in the workforce. So I think that's a big part of it. The other part is, and this is where I'm going to not, borrow from my colleagues across the political aisle, is there is a fair argument for saying that government, in terms of its oversight and regulatory requirements, disincentivizes innovation and disincentivizes the ability to look at new models that could potentially break through. There's lots of examples where government did something and it was very bureaucratically burdensome. And then when someone in the private sector came up with a new idea, they were able to break through a lot of the barriers that we thought were going to be there. So I personally am very open to hearing from all of you who are doing the day-to-day work as to what regulations and what government structures need to either be reformed or removed to allow more sustainability and innovation. I think the balance that comes up is the great fear that any elected official or any appointed official has is that a regulation is removed and there's some tragic circumstance or newspaper article about lack of quality or, God forbid, a really terrible circumstance that arises. And when we're talking about early childhood education and childcare, that is a nightmare scenario. And so there's going to be a default to being very bureaucratically minutia driven. And I'm sure all of you see that in your day-to-day work in terms of what areas government is regulating. I think that there is a fair need to look at what regulations actually matter and what regulations are preventing innovation that we likely need to solve these problems. And so I'm certainly open to that discussion.
Thank you. Thank you both, because it sounds like we're all going to be in your offices next year if elected. So thank you for that.
Well, we'll see. We'll know after November 5th.
True. Well, we are pretty much out of time. But I do just want to thank you both for coming. As I mentioned at the top, we invited 12 candidates and 2 of them showed up. So I would love to thank the both of you, Representative Venkat running in House District 30 and candidate Hadley Haas running in House District 44. I encourage all of those in the audience to make sure you know what your candidates think before you go out and you vote for them, and make sure that you're hearing them talk about the issues that you think are important to you. So I do thank you both for attending tonight. I would love to give you both, a minute each just to close out if you would like. Candidate Haas, do you mind?
Sure. No, absolutely. Thank you again for this opportunity. It's really, this is an important issue that's close to my heart. So I appreciate the forum to talk about these issues. As I said before, I really come to this as an advocate, and my advocacy has been shaped by my perspectives as a parent. I started my work with the Hearing Center at Children's Hospital of Pittsburgh because I looked around waiting rooms and realized that if these decisions were this difficult and daunting for my family with all the access and privilege that we had, that it would be unbelievably difficult for other families, for single moms who couldn't drop everything and go to speech therapy appointments, and non-native English speakers to navigate these types of decisions. And so I started that work by funding or raising money to hire an educational liaison who's an advocate for families in the area of children with hearing loss. And I just share that because I think it's just the work that brought me to this is making sure that I use my position and my privilege and my voice to fight for people who haven't had the same types of advantages that I've had. And I will always show up and listen and treat people with compassion and respect. And I look at this job as being an advocate for my neighbors and taking their concerns back to Harrisburg. And it's not just about standing next to checks or awarding certificates. It's about showing up and doing the hard work and having the hard conversations. And so that's why I'm here, and that's how I'll do this job. And if you live in House District 44, which is the western communities along the western edge of Allegheny County, or you know people who do, I appreciate your consideration and your support.
Thank you. Representative Venkat, in closing remarks.
Well, first of all, thanks to all of you for taking time on a weekday evening to talk about these important issues. When I ran 2 years ago, I made a point to join this forum, and I'm obviously here again. As I told you, I'm an emergency physician. I went into emergency medicine because I knew I was going to be able to care for anyone, no questions asked. But in the emergency department, you really see the gaps in your community and the challenges that we face. So in the 17 years that I've practiced in this community, I've seen the lack of health insurance and its impact on, the well-being of our community. I've seen the opioid crisis, the mental health issues that we continue to have to this day, the pandemic, and it goes on and on and on. But what I also recognize, and I think the pandemic probably crystallized this for all of us, is that so much of the well-being of our community is beyond anything that I, as a physician or any healthcare professional, do. We saw during the pandemic that so-called social determinants of health, whether it's housing, whether it's early childhood education, whether it's having a good job, clean environment, safe schools, you name it, directly go to whether we have a thriving community, not only here in Western Pennsylvania, but across the state and across the country. And so that's why I honestly decided to run for office, because I felt like for giving back to the community that, that has given so much to me and my family, that this was a way to return that and to be a voice for my community with the perspective that I have as an emergency physician, and I do still practice and see patients in that regard. So, sorry, for me, in this election, and I know some of you are probably in my district, certainly many of you serve people who are in my district. I've tried to focus over the last 2 years in staying connected with the community, being very transparent about the things that I am trying to advocate for our community and for our state, and to be someone who is listening and trying to understand the many challenges that we face and what are the pragmatic ways for us to address these challenges. And that's what I'll continue to do if I'm privileged enough to be reelected this November.
Thank you both so much. Thank you everyone for being here. Remember, November 5th is the day to vote if you have not voted already, and I will see you all at the polls. Be sure to follow us on Facebook. I believe it's in the chat. I will post it back in there. That's where you can follow everything going on with the child care voter van and all of our information that we'll be sharing leading up to the election. So thank you all so much, and I hope you have a great night.
Thanks so much,
Thank you.
Whitney. Take care,
Thanks for being
everybody.
here.